as Black women in medicine, it's, kind of different, and then when I put on the white coat, then everything magically changed. Like everything I say is law.
I say, well, I'm your physician, and I'm Dr. Maga Wang. They say, oh, I'm sorry, doctor. I'm like, oh no, that's okay, it's all right.
I've been the nurse, I've been the aide, I've been somebody's child that's just coming to work with mom today. So glad we took this vacation. We really needed it. We needed this girl trip just to get away. I'm relaxed. Just coming here, haven't even started, I'm relaxed. I needed this. It's just so important as a physician and as a Black woman and as a human being, just to take time away for yourself. Self-care is so important. We preach it to our patients, but we have to practice it more.
Yeah, it was really needed. I'm glad we're here.
I definitely need it. It felt good waking up without my dogs barking.
To peace and quiet.
Yes.
Definitely. Peace, quiet, just relaxation. It's good for the soul.
Yes, yes.
I'm excited. Because we usually don't have that time. So having us 4 women here, it's a plus for us to relax and bond together. It's, to me, it's a great experience that we need to do that more often.
Yeah, and a break from the day-to-day. I normally work like 6 days a week, so this is like my first weekend off in a very long time.
Good for you, because I know it's hard.
7 days a week for me sometimes.
Oh no, I can't.
So I'm happy.
Ooh, it's so many, so much to do, but medicine is rewarding. I think it's rewarding. It has its barriers, to say the least.
Absolutely.
Definitely, definitely.
I guess, especially, as Black women in medicine, it's, kind of different. We have a different approach to things. We see things differently, but also our patients look at us differently. As far as, when we come in as a provider. I know for me, especially, I can tell the difference of, if I walk in, coming from being a nurse to a nurse practitioner, when I walk in, usually people assume, I'm the nurse or the MA or something like that. But then, and then when I put on the white coat, then everything magically changed. Like everything I say is law, and of course, but if I could tell you the same things without my white coat on, it's like, I need to see the doctor. So.
I think it's something that we also face as physicians and then women of color, because those things that you're saying, I also go through them, because you walk into a room and then a patient might say to their family member on the phone, the nurse is here, and then I just smile, because I was a nurse before, so it's not even, that's a profession that I really love. So I'm like, okay. I say, well, I'm your physician, and I'm Dr. Maga Wang. It's nice to meet you. So you just introduce yourself. They say, oh, I'm sorry, doctor. I'm like, oh no, that's okay, it's all right. But you are there in that capacity as a physician. You look at it and you're like, all this time in school, all the energy that you've put in, and for someone to try to belittle you. But I take it with grace, because with God first, everything is possible. So you just go with the flow and you talk to your patient and see them for that time that you are there. But those are the biases, those are things you face as Black women.
Yes, I turn it into a joke or something funny and just make light of it. But yeah, same scenario. Someone's on the phone, even though I say, hello, Dr. Kendall, I'll be your doctor. And they were like, oh, the nurse is in here. Let me call you back. And I was like, that's not what I said. But okay. There are layers to the barriers that we face daily. But I don't let them get in my way because I have to understand why I'm here and remember why I'm here, which is for the patients and to give good care and provide good medicine. Does it bother me? Yeah, maybe sometimes it does bother me that, somebody would say, oh, are you sure you're the doctor? Do you know this? Do you know about my case? And it's like, no, I read your chart. Like, I understand. Or sometimes it helps me when I've done something for them already, and so they didn't see me yet, but I was like, I'm the doctor that started this pain medication because your nurse practitioner requested it. Yeah, I've been the nurse, I've been the aide, I've been somebody's child that's just coming to work with mom today. It gets very interesting.
Yeah.
And to your point of the white coat, I don't know, like I guess when I went to residency, we did more jackets. And so I'm so not anti-white coat because I don't mind wearing it, but especially being in the nursing homes, I just want to be, going to therapy and stuff. I don't want to have to put on a white coat, but it's like I keep fighting it. But if I put it on, it'll save me so much more like trouble.
Right.
So maybe one day I'll conform.
Well, the white coat is a gift and a curse sometimes. At some places, at my other job, I definitely don't wear a white coat. I just wear my regular clothes so I can come in and come out, because once they see the white coat, now everybody needs something. So, so sometimes if you want to be incognito, you need that white coat.
Wow, that's interesting.
Yeah.
Interesting. Well, medicine is definitely, I think it's very rewarding. And being a nurse before, I think that it actually opened my eyes to look at things differently. And, to look at patients as a whole. And you are looking at, when you are talking to patients and talking to other people, it flows. I think that as a nurse, being a nurse before, I don't think I think I take things too personally.
No.
I noticed that that's one of the things that has helped me. And then just interactions with patients on that level, because I can go as low as you want me to, it's because I see patients ages 2 and up. So I can go as low as you want me to, and I could go up, so I have to like fit every level of the patients, and I think that's basically what made me go into medicine, because I wanted to really help my patients and to look at the patients really as a whole, not just looking at the patient that, a patient comes into the office, they are saying that I have a headache, and then I'm just focusing on that headache. I tend to realize that I try to look at that patient, ask questions about family, kids, things like that.
Stressors.
What gives you stress? How do you relax yourself? And as the patient is talking to you and answering those questions, I've come to realize, Doctor, why you trying to tell me that it's my kids that are stressing me out? I said, I didn't say that. So yeah, but now I realize that that's what it is, so those type of things, looking at that patient as a whole and treating the entire person makes a lot of difference, so that then patients at that time get much satisfaction, because you have literally sat there, listened to them, listen to everything about them, and then subsequent visit for that patient then don't become a problem. Right. They are quickly they want to quickly get out, because from the first visit when you saw them, you spend that time with them and getting to know them and the whole entire family. That's one thing I love about medicine. It's so rewarding, even though it's stressful. We are here on vacation to relax and to distress ourselves, but it's a rewarding profession for me.
What do you think about when you speaking to someone and they pick up your accent and don't understand what you're saying? Have you ever had those experiences?
Oh yeah, definitely. And coming from I'm originally from Cameroon, so came here at the age of 17, 18. So my accent is there, and patients, when they say that to me, I try to like tone it down a little bit and then try to make sure that they understand what I'm saying. And then certain times, some people don't have issues with that. Those are some of the barriers. Then some people have issues with it. But because you're from a multicultural area where you still have family members who speak the raw language, let me say that. So sometimes you have to tone yourself to relate to them. And then when you're seeing patients, you have to up yourself a little bit to relate to your patients. And
Yes.
so that is some of the barriers that, as a woman of multicultural dynamics, you face those barriers with your patients. But
Yeah. I think I've seen it a lot. It wasn't as big of a problem in New York because of the big West Indian community. There's a lot of Trinidadians in New York, and so that wasn't a problem. But as I moved to the South, I realized that I'm like, I don't have an accent. And they're like, no, you have an accent. It's like, okay. So, yeah. And most people who tell me, oh, I've never heard your accent, most times I'm going to say, because you didn't make me mad. Piss me off and then you'll hear my accent. It's a good thing that you never heard it. But it doesn't bother me if I have to adjust for people. I guess I've been doing it so long. I think when I was younger, I had a stronger accent, and I just got tired of people saying, huh, what are you saying? Huh, what does that mean? So then I just adjusted as time went on. And so I feel like I don't have an accent now, but some people may think I do. But I've learned to just kind of adjust it, and I don't take it personal. It's just like, okay, my purpose is to communicate with you, so whatever I have to do to
accommodate the patients.
Yeah.
But our
colleague doesn't have that problem.
She doesn't have an accent, so she doesn't face what we face because she was born here. I would say that. So
I was born here, but we also, as Black Americans, they call something called code switching. And what it is like, I'm from the west side of Atlanta, and we most definitely have a distinctive accent in the west side of Atlanta. Luckily, my mom and my dad talked a certain way, so I just talk a certain way. So you wouldn't, when I'm from Atlanta, most people say, you're not from Atlanta, you don't have an accent, you don't have an Atlanta accent. And I said, I really do. If you hear me with my friends, you for sure know that I'm from Atlanta. Yeah, but so what we call it is, because you have most Black people have a at work voice and a at home voice. And so it's like, so we do, kind of adjust our voices, our accents, our slangs, when we're with patients. And then I can see if I meet another person and they're from Atlanta, then I get more relaxed with the way that I speak with them. And I do notice that it's like a different type of tone and accent when I speak to patients. So it's not like I don't have a heavy accent, so they're not going to ask me if I'm from, the Caribbean or something else. Most people think I'm from California for some reason. I don't know why. Wow. But so I do get how you can kind of tone it down. And sometimes it's not even... It's like it comes naturally. Like you don't even realize that you've changed your tone, or until you're like, oh, okay, I don't really sound like that. So yeah, but I do get where you're coming from as far as I have some people after going in after the doctor, they'll say, well, what did she say? And I'm like, you've been here for 30 minutes talking to her, and you didn't know what she said.
And didn't ask any questions.
Yeah.
It was interesting to hear what Star was speaking about, just even being an American and knowing that she talks different to her common like friends from her area versus when she's at work or talking to somebody else that may not be from her side of town. So it's interesting to know that so many of us go through this. My question is, and this may be a little edgy, but like our white counterparts, do they have to switch as much as we do when coming to talk to different people? Because I've spoken to a lot of people about having to change what Dr. Kendall or what Jamila shows up based on who I'm having a conversation with, and always wondering if like, do they have more of a steady stream of I talk this way to everyone, or do they go through it as well? I don't know. Very interesting conversation to have.
Star, who mentions that, who was born here, talk about how she also goes through that, you know, with the slang she has when she's with her friends, and then when she's in the medical profession. It made me realize that we are all going through that struggle. And Dr. Kendall also mentioned that, her being from the Caribbean country, that even though she came here as a young girl, she still goes through that struggle. So it's not just me. And, you know, sometimes it gets frustrating, being honest, but you handle it with grace. And you continue to work on it and making sure in the back of your mind that it's your patience that comes first. But it's very interesting. Yeah, it's very interesting that the dynamics we go through as Black women and Black women in medicine. But I just want to give props to the Black American community that have paved the way for us, you know, coming here from foreign countries. Without them, I don't think we could have made it this far. It's something that I deeply appreciate. Me coming here, going to high school, and then I finished from Albany State University, my friends there. I mean, it's just, I see how I was able to adapt, and you realize that this was a lot of work that was put in by people that were here before us. And I always say, I deeply appreciate that. And I deeply appreciate my Black women friends, my colleagues, because without that togetherness and without that appreciation of each other, I don't think we will be here.
Absolutely not.
Yeah.
You know, I'm always gracious for Dr. Wayne. She's given me my first start as a nurse practitioner. So I'm always gracious. Like, if anyone ever asks me if I know a good doctor, I'm the first person on my list. The first person.
She's a great doctor. She is a great doctor.
She's very empowering. She's taught me so much. And, you know, so she is an inspiration and a mentor for me. And, you know, she's always giving me a lot of opportunities, so I'm always gracious to her.
And always showing that Black women can be together and be positive and push each other up. I think that's so important, just to show the different sides of that. Yeah, is very important.
Yeah, definitely. Because one of the things we have to understand as Black women is that someone's success doesn't stop you from succeeding. Right. Somebody's grace or movement above the ladder doesn't stop you from getting there. And I believe that appreciating that and supporting that of another Black female gives you, I think that opened doors for you. That's what, you know, me getting older, what does it cost me to stand there for the younger generation? It doesn't change what I have accomplished. It doesn't change who I am. It makes me, you know, realize that, you know, just giving back, you know, and just helping, you know, that gives me so much satisfaction, so much satisfaction. And then what happens is that those, especially the medical students, the resident doctors, the ones who train in my office, they come back every year. I have about 20 of them passing through the office every year that just come to say, Dr. Guan, how are you doing? I'm doing well in residency. You know, this one has finished cardiologist, rheumatologist, you know, anesthesiologist. So all infectious disease doctors. I mean, I think I am blessed. It's not about money. I am so blessed because of all of them that always call upon me to check up on me. So I am blessed. So I want people to realize that as long as you help, your community gets bigger. To me, that is money. That is money that you cannot
richness.
buy.
That is being, yes. It's just helping others. And I think that comes from that nursing core of always being satisfied and happy by helping other people. It is rewarding. It is rewarding. Being earlier in my medical career, I still want to put the hand down and reach down and kind of show other Black females and just the younger generation in general, just show them my specialty, because I feel like a lot of us don't, like, we all go into OB, primary care, like internal medicine, family medicine, but no one goes into rehab because we don't get enough exposure to it. And so I want to be able to expose some of the upcoming generation to rehab medicine and showing them different things that you can do, and you're still helping the community.
Thank you. How you guys doing?
Medicine definitely takes away from big events when you're with your family that you can't, like, you may have to miss sometimes if you're on call or you're on a shift. So I definitely have had sacrifices that I had to make for medicine, unfortunately.
I think for me too, I have missed a lot of occasions back in Cameroon because of just my schedule. Having a private practice, it's like you have to plan ahead of time. I've been to some, but you can't go all the time because one, it's expensive, and then two, you have commitments to your patients. So it's like it's a balance. You have to find that balance and find that right time for you to do that international travel. But I do it, but you really have to adjust your schedule. So those are some of the sacrifices that I've made. And for me also, going to med school was a big sacrifice also, because being a nurse before and then had to leave my kids to go to med school, that was really a big sacrifice. But I knew that without me doing that, I was not going to be able to take care of them when it came time for them to be in college. So I know sometimes it's like a mixed feelings, but in terms of them going to college and not having a loan, it was a good thing for me because they all came out of undergraduate without loans. So that was one thing I needed my kids to have. You know, so that was a sacrifice for me, but at the same time, it was something I needed to do for them.
I made a lot of sacrifices. To this day, I still regret never making it to the funeral of my best friend's mom because I was in Germany and I couldn't make it back and they didn't approve my leave. Just small things like that in family is so important to me, but all for the greater mission. Sacrifices have to be made. For my husband, thank him a million, just knowing that he had to hold off on being a dad until my medical school journey was finished. Although he had been there through my entire nursing journey. It's a lot to deal with, but he saw the bigger picture and he saw the goal, the end goal. And now that we're here, it's so worth it. And to have kids now and know that they're looking at you and they're looking up to you and using you as their role model for what they will do in the future it's important.
God being in my life first, my children came first. So I decided to pursue that journey. It was not an easy journey. It was difficult. But through all that, I see that that sacrifice, it meant a lot for them. And when I look at my kids today, they have accomplished a lot. They are in their prime in their career because of that sacrifice. And listening to all the women today, I believe that women have a very strong intuition about their children. Women, I'm not saying men are not dedicated. I think women are dedicated, determined, and dependable to their children.
I'm interested to find out what we think is a sacrifice and we feel like bad for sacrifice, and how do your kids feel now on the other side of it? Do they feel as bad as you felt sacrificing? Like, do they say, no mom, it's okay, like we understood what you were doing, we knew, you know? I just want to see both sides. Like,
having Dr. Wang and Dr. Kendall express how they put in a lot of sacrifice into what they do to become who they are today. The same thing goes with the MPs, especially MPs that, you know, you've already had a family and having to go to school and balance things out. So it's just a great thing. And I feel like I'm not the only one that have done the same thing. I've seen other people that have contributed immensely into their profession.
I think for me, during the time I was in school and through residency, my son made a comment one time where he said he could calculate how many times I've been with him. You know, because I've been away so much, he can calculate it. And I think when he looks back, he tells me that, you know, Mom, I'm very happy because you going to med school gave us another perspective in life. You know, it opened their horizon and things like that. Now he appreciates it. But at that time, at that age, he was looking at it as me being away from him. So, but at the end of it, I think it was a good thing for me to do for my children, because that's what really prompts me to go to med school, my kids.
that's interesting. Because with me being a nurse, there was nothing wrong with it. I loved it. I traveled, I learned everything. So I wouldn't say that it was, oh, I don't want to be a nurse anymore, that's why I became a doctor. But along the same lines, I knew that to give my family a certain level of comfort, I had to promote my career and do something more. And I started reaching a ceiling in nursing where I felt like I may have sometimes wanted to do something a little different than the doctors, and I couldn't because I still had to listen to what, you know, respect their authority and their hierarchy. So at times I just have to, you know, you like, hey, this is how I would want to do it, but you're the doctor. So it's just like, you know, instead of having more situations like that, let me go back to med school and do it so that I can make those decisions, and the plan of care can be the plan of care that I want. But also looking at the family and the bigger picture. So I applaud you for that, and just seeing you, you know, as a foreshadowing of what I will have in the future now that I'm on the other side of, you know, medicine and the other side of nursing with 2 little ones now. So my sacrifice, I would say, was more of begging, asking my husband to just hold on for a little while longer. We can't have kids yet. Hold on. Let me finish this degree. Let me finish this journey. But having kids later in life also, I think, is rewarding, and I'm prepared. I'm prepared now than I would have been if I did it straight after nursing.
What about you?
Well, for me, I can tell you that when I went to nursing school, I already had my 3 kids, and I think the youngest was like maybe about 8 months when I left for Alabama, because I went to school in Alabama. So my entire family were here in Georgia when I made the trip to Alabama. I was literally like living in Alabama. Then I was making a trip once a month, you know, to come and make sure everything is fine, then cook for the family, then go back. If I have to think about it, it was a huge sacrifice, and I've never for once regret from taking that bold step to leave my family to go all the way to Alabama to better my life, to enhance my life, because it's something that I've always wanted to do. Even coming all the way from West Africa, Nigeria to United States, one of the main things on my mind then was going back to school to learn, to enhance myself and also get into modeling acts. But the modeling thing really didn't work out. So I had the opportunity of really fulfilling my dream by becoming a registered nurse, from registered nurse to becoming an MP. Then from MP, I was like, you know what, I'm not gonna stop here. I still wanna get my doctorate degree, and I went further by obtaining that too. So that was a huge thing. But I remember though, of course I did miss home during that time, because my little ones, my youngest one was like about 8 months when I left. So it was a huge, I can tell you, it was painful, but but the overall picture of it is well worth it. Because today I can tell you that I can provide for them. I can give them the kind of life they really want. And through all my dedication, I've been able to inspire them. I've been able to be like a role model to my kids, because I listen to them telling, like my daughter will be finishing very soon from a nursing program, and she was like, Mom, I can't believe you went through all of this, and you have 3 kids going through all of this, and like a program that is this extensive, And I was like, well, it's something that if you really want something, you have to go for it. Right. So I made the sacrifice, and till today, my kids are very appreciative of what I did for them. And I'm not a millionaire, but at least I can put food on the table for my kids. And that's what is most important right now. Right. So, right.
We can show them more than we could tell them or teach them. Just showing them you as a role model and how much sacrifice, how hard it was, and you still did it. They're looking, they're seeing that, and they're modeling that, as you can tell with your daughter. That's awesome. That's awesome.
And I can tell you that with my own experience and also with the path that I've taken, that has actually also encouraged my daughter to also want to go higher in her education. She was like, Mom, actually, as a matter of fact, she wanted to become an MD before. So, but now she's now leaning towards CRNA. After that, right, she wanted to get the CRNA thing and then be a nurse anesthetist. So that's her aim. And same with my son, because I have 2 sons too. It's like they're always telling me, Mom, I wish I can have a wife like you. You are a role model. You're doing a fabulous job. So it's very inspiring. And every day they give me like all those positive affirmation. It just encourages me more. And I'm like, okay, this is well worth it at the end of the day.
Definitely. The role of a nurse practitioner, to me, as a physician who was a nurse before, I think I look at it differently, because I look at nurse practitioner being an asset to me. That's how I value them, because they make us who we are today. So it's they are our eyes. They see patients with us, and then they are under our supervision for the state of Georgia, which is working with them. To me, it's an amazing experience. They do a lot. And then it's something that I really do appreciate. And looking at them, why I say that is because the nurse practitioners have that interrelationship with the patients. They have that level of bedside manners that really the patient wants. So it's very important that as physicians, I would say that we appreciate them and make sure they know that they are a valuable part of us. It has made our jobs lighter. It has made our jobs easier, I believe. So I want to say kudos to the NPs. Definitely there are differences. We are physicians. We went to school, medical school for 4 years. We did residency, depends which one you did. I did family medicine. I did a 3-year residency. So 7 years total Also, the same for the nurse practitioner. They were nurses with their bachelor's degree, and they did a 2-year program to become a nurse practitioner. So, under the supervision of a physician. So, they have that medical knowledge there, and they are really being monitored by the doctors. So, they can give you the care you need, and they are valuable to the society. That's what I really want the community to know. They are a great impact in the community. They have helped medicine. They are in the hospitals, they are in doctors' offices to give us that, help us with that load, patient load, that by ourselves we cannot handle. So I want to say kudos to the NPs, and we truly, truly appreciate you guys. Without you guys, we will not be where we are today. Without nurses, let me say that again, without nurses, we will not be the doctors that we are today. So we want to appreciate nurses that are out there. First, I was a nurse before becoming a physician, so kudos to nursing.
I must say, just recapping what we spoke about when we were outside in the gazebo, just seeing how small words can go so far. To hear a nurse practitioner with so much experience be so happy to hear physicians say that, you know, we understand her worth, we understand what she brings to the table, and we couldn't do our job without her. I think that was very, very sweet to know and understand, because it's easy for us to say it, it's easy for us to know that, but it's something else for us to actually repeat it back to those who count.
To me, it brought pain into my heart, because I believe that NPs give a lot to physicians. They make things happen. They are a great asset to us. And I hope that my colleagues will realize that without nurse practitioners and basically nursing, we will not even be where we are today. Because I'll explain to you guys, when you are in residency, basically nurses on the floor are there guiding you, because some of those nurses have practiced for 30 years. So they are there guiding you as you move along in your medical career.
Kudos to nurses. They're the eyes and the ears of the floor, and they get that piece from the patient that you may not have time to get, and then they fill you in. So I feel like they're such a great asset to the team, and it's just about working together for the common goal of patient care. So no, definitely I appreciate my nurses and nurse practitioners. The whole team we're needed, because the more they put on us, the more patients they want us to see in a certain amount of time. It's becoming impossible to do everything, and so you need a team to help you bridge that gap and still give the patients the care that they need.
Right. And I would like to thank you guys, for really appreciating the NPs, because really it's, we live in a world that some doctors really don't value NPs that much. I have to say, because I've worked in a hospital setting and also in an outside setting, and I can tell you that from my experience, it seems like some doctors, they just look down, they're kind of condescending towards the NPs. They feel like, oh, the NPs are not knowledgeable enough, they don't know what they're doing. But hearing this from both of you, I mean, I really do want to appreciate you both. And it's like you guys are really advocating for NPs out there, and it's something that I would definitely, I'm going to hold on to forever. I really want to thank you. So I work in a hospital, so just like to buttress your point, doctors these days, they see a lot of patients. Their workload is becoming so extensive that, you can imagine having to see 30 patients on a daily basis. That is ridiculous. So having NPs on board to help them with the workload, to relieve them of what they're doing, is something great. And we are here to support. We are not here to steal the job of the doctors. We are here to support. That's what we are here for. I went to school and I know what I went through in my program. I went through an extensive program too. So I can't just be out there practicing medicine if I don't know what I'm doing. So I just needed somebody to tell me, oh, you know what, I see what you do, and I really appreciate what you're doing. So thank you, Father. Thank you for supporting us. Thank you for being there when we need you. And that's all we need. We are not here. I mean, salary-wise, you can't compare, you know. Job-wise, we are doing, it might be like we're doing the same thing, but overall, it's still different in one way or the other. So thank you for advocating for us. And I think you can really speak like this because you were once a nurse too. So you know the pain that nurses have been through in the past. So thank you for all you do. Thank you so much. Thank you.
Yes.
I've worked with a lot of doctors that really do appreciate what the MPs do contribute as a whole. And I've had an encounter with a lot of doctors that really doesn't think we're valuable in this society. So it's just so painful how the MPs have been treated. When you're talking about salary-wise, we're not being treated fairly. When you're talking about having the autonomy, especially in the state of Georgia, unfortunately, I don't think maybe we're going to get it one day. I don't know.
I think, yeah, me and Dr. Wong, we have a different perspective than other doctors because we've been a nurse. We've been bedside nurses. We've been in the trenches doing all the work and having, you know, all the patients and juggling different things. So we understand and we know the heart of a nurse. Even when you become a nurse practitioner, I know the heart is still to just take care of patients and do a good job. And unfortunately, I can't speak for my colleagues, but you know, I think sometimes it just comes from a misunderstanding and a lack of understanding, not wanting to cross the lines and just understand what the difference is and how you can work as a team and help each other out to make the patient load better.
I just appreciated what Kristen said about us appreciating her. It brought joy into my heart to see that, because I just believe that nurse practitioners work very hard. And I just also want to say I appreciate this vacation. It was a much needed vacation.
I think for us as physicians, I think the more awareness, the more the doctors see, you know, the importance of NPs. Because when you're in the hospital setting, you see that. You see that you know, they are helping you with admissions. You go in, you review, collaborate, and sign. So that definitely decreased that workload for you. Even in your offices, you can have some days where you could see your patients in a nursing home while, you know, your NPs are in your offices, or, you know, half day here, they are working with you in the nursing homes. So it's just, you have to look at it as that they are here collaborating with you. And at the same time, you're teaching them.
Times have changed from when I first was in nursing. White coats meant you're the MD. Now it means you're the provider. The provider can be a nurse practitioner, it can be a PA, and it can be an MD. So that, until we find a better way to distinguish ourselves, I know some jobs and some hospitals will probably write, you know, your credentials really big on your name tag. But for me, I'm in private practice, we don't have name tags. So it's just more of an explanation to everyone, letting them know the difference in the schooling between nurse practitioner, MD, nursing, and, you know, like nurse practitioner is a master's in nursing, you know, medical doctor is a doctorate. It's two different journeys, but at the same time, I think the biggest thing to gain from this is not what makes us different, but what makes us the same. And that's that we all want to provide top class care to our patients.
You know, I just love the essence of teaching, and me working with Morehouse School of Medicine as an adjunct clinical faculty. That's definitely make me realize that we as physicians, we have so much to give. We have a lot of mentoring to do. And I also train the foreign medical graduates that work with me until they go on for residency. So that gives me so much satisfaction. And I mean, I can't say how I appreciate all of them, you know, in my office and as part of me. So it's just important for us as doctors to just realize that, you know, the people around us make us who we are. By ourselves, we cannot stand, but together we stand tall. So let's make a toast for continuing improvement in medicine, collaborating with our nurse practitioners and PAs that work with us. We just want to say that together we stand tall, together we stay firm and continue to practice medicine.
That's right. Cheers.
And thank you guys for this vacation. I've really...
It's been wonderful. It's been wonderful.
You.